Welcome back to Autism Live. We are continuing our conversation with Lee Grossman, who has been such an influence in the autism community over the last 30 years. We're thrilled to be talking with him. And Lee, I wanted to talk a little bit about, we've talked about how you became part of the autism community and were such a force as the president of the Autism Society of America, but your role has shifted significantly. And one of the things that you're involved in right now. We've talked a little bit on the show before about P2i, but we might have new viewers who haven't heard about it, and something called the Forum. So very briefly, I'd like for you to give us the master class on what this is and why you're so interested and involved with these projects.
Well, I'm on the board of directors of the Forum Institute, and the Forum is an organization that's based out of Portland, Oregon. You've had on your program before Dave Humphrey, who's the chair of the board of the Forum Institute, and it is a organization that's been very significant in leading some major initiatives forward in autism. For example, the predecessor to the Forum, really essentially the same board as what's there now, is the group that founded, started, and funded the Autism Treatment Network, which is the largest program among multi-hospital or medical center-based programs in the world. That's now a project of Autism Speaks and continues and remains very successful. The Forum is also responsible for, they help fund and perpetuate our information at ASA with the environmental project that we had. The Forum also was the impetus behind the GI and autism public consensus document that was published in the Journal of Pediatrics that really established the GI problems in autism, or putting it into the mainstream. 2 years ago, the Forum published another major consensus conference journal paper in the Journal of Pediatrics, and this was on early diagnosis and early intervention. So it's a group that I'm very, very proud to be involved with. Our major initiative right now is this initiative called P2i, which is preconception through infancy. Preconception meaning that before a couple even during the time that they're considering having a child, what is it that they need to do so that that child can be healthy? And the science behind this basically states that if prior to a woman getting pregnant, if you look at the health issues that she's faced with, and you address those health issues and make her as healthy as possible, then the chances of her having a full-term birth with a healthy child, having that pregnancy go well, those percentages greatly improve. The United States today has among some of the worst outcomes in health related to pregnancy and childbirth in the developed world. And it's our objective with the P2i program is to change that directory and improve the outcomes, not only in the U.S. but around the world. We have developed a unique way of testing the families prior to the woman becoming pregnant, testing her through the pregnancy, testing her after birth, and the infant, and it's our intent through our program to follow that family from the preconception period through the first 5 years of the child's life, assuring that they're healthy, addressing any environmental factors that they've been exposed to, and recommending any interventions that need to be done. It's based on information and science that is already well recognized and that there's consensus around. What has not happened is that there hasn't been a project to consolidate that information and put it into practice. And we've developed a relationship with others so that we can take that information as the data is coming out, and we're seeing families and women through the clinic take that information, evaluate the outcomes, and as we believe that they're going to show that the outcomes improve, that we'll have a direct pipeline to introduce our results into the public health service so that this well-known information is then included in all the practices around the U.S. and around the world.
And
It's a
and
very, very exciting project. We
it
feel it's
is.
going to transform healthcare because the chronic health conditions that a person has across their lifespan, many of them are embedded before the child is even conceived because they're carried on from generation to generation. So if we can find those before a woman even gets pregnant and address those, then the chances of that child having a healthier life are greatly improved.
And there is, in fact, already data from P2i that shows that there's every reason to be, because you're involved in bigger studies now, but there's every reason to believe that the bigger studies are going to replicate what the smaller group studies have shown, which is that you can make a tremendous difference. And I think it's important for people to know that it isn't just talking about autism, but that when the mother is healthy, as you said, the baby is healthier, and there are significantly fewer incidences of all of the major childhood diseases, including pediatric cancer, pediatric diabetes. I get very excited when you and Dave Humphrey talk about these kinds of things, because this is where we have to go. And I always want to talk about P2i because I think that this is when we go to the general public talking about autism, they want to know, what do I need to know, because they would like to make sure that they have the healthiest child possible.
Mm-hmm.
And I don't think this information gets to them enough, although you and I are both trying to get this information to people, that there are ways and studies being done that are showing that you can have an impact on the health of your child.
That's part of our project, is that we will have, at the time that we launch it, and we're hoping that we can launch the clinic in about 6 months. At the same time that we're launching the clinic, we're going to have a very, very engaging virtual campus that will have the information that we'll be delivering in the clinic available to anybody that wants to access it. There'll be studies in there showing the proof of concept. The fact that in 2006 the CDC published a significant paper showing that this process that we are implementing will work, and that has been cited in over 350 peer-review articles since then. So this is not anything new. This is basically just taking the information out there and consolidating it. So when we have that campus, the virtual campus set up, people will have access to what the professionals are saying. There'll be online communities there for families and to share information or to get information. We want to democratize this process. This is not information that should be held to a few. This should be information that everybody on the planet knows and has access to, and that's part of what we intend to do.
And where can people go for more information before the virtual campus is set up?
Well, right now we have a mock website up. It's not, there is a little bit of information, and it's p2iforum.com. And so there is some information available there, just kind of with the concept. Please understand that that website is very much in its draft phase and is not completed. So, but there is information there in terms of the papers that we're referencing, like the CDC's paper and what this is based on, the science behind P2i.